So they come in the yellow door, so emergency department COVID. And so you can see there's a nurse in there in full PPE who's assessing that patient who's got COVID symptoms. Where we've previously put a lot of people through the COVID stream, they didn't actually have COVID. Right. Now we're putting a lot of people through the COVID stream and they have COVID. Yeah. And they have COVID bad. If you look at anybody's notes over there at the moment, it's COVID. It all reads exactly the same. 82-year-old lady visited by her daughter/granddaughter on Christmas Day who tested positive for COVID 2 days later. Yeah. And boom, here she is now a week to 10 days later. And these people got COVID for Christmas from their children. Yes. You know? Despite all the advice, don't do it, don't visit your grandparents, don't have big meetings. Yes. They went and gave them big hugs and delivered COVID for Christmas.
All right, folks, let's go. His diagnosis is COVID pneumonitis. He got intubated yesterday morning because of worsening hypoxemia.
I think right at the moment we have just surpassed the peak number of patients that were admitted to hospital during the first wave, and numbers continue to increase. Within the intensive care units throughout the country, we've got about 75 patients who are COVID positive within intensive cares, which is about half of what we were at the peak of the first wave. Following those patterns, it's likely that the ICU admissions are going to increase steeply over the next week or two. And if we're at least peak hospital admissions, it's highly likely over the coming weeks we will get to or we'll exceed the number of patients that we saw in ICUs during the first wave of COVID.
We're only at the start of wave 3, unfortunately. So the numbers that you're seeing in hospital at the moment are the start of what's to come, and we're nowhere near our peak. And I think that we're probably some weeks away from where this is going to peak.
Are you halfway to peak in terms of numbers?
No.
Yeah, absolutely. Yeah, I'm very worried. We've had to convert a number of other wards into COVID wards because we've had so many patients presenting, so the hospital is getting very full. The numbers are only going to increase over the next couple of weeks, so we are bracing ourselves for that. It's going to be very, very challenging.
Our colleagues are all getting sick, and we are very much overwhelmed, and staff-wise are overwhelmed, and we're doing our best to create a positive aura in this department and in the whole hospital.
Each red curve that you see on the screen is a positive sample and a positive patient, and the sooner that the curve appears on the graph, the more virus that's present, so the stronger that infection is for that patient. Yeah, definitely in the last week with the third wave, we've definitely gotten a lot more positives, so it's just more time consuming having to report those and pull those forms and make sure that those patients are aware that they need to be isolated.
We have people that we haven't discharged yet, people who would have had infections in March and April who are still under our care, who are still trying to help them manage their symptoms, who still aren't back to work. The average age of our patients in our post-COVID clinic is about 40, but we have patients as young as 16. We already have a big waiting list, and it does worry me when I think of all the people getting sick now. Some people will be fine, but there is going to be a big portion of people who have a hard time after this, unfortunately, yeah.
She was never prone, intubated or paralysed initially.
We have a surge plan in place, so we have a physical location to look after an excess of patients. We know where the ventilators are, we know where the beds are, so we are greater prepared for this than we were back in March. The very fact that they are surge plans, though, means that it will impact on other services within the hospital. So to deal with these numbers, it won't be possible to continue business as normal within the hospital, and some of the elective work will have to be pulled back to look after the critically ill.
The pattern of patients that we saw presenting to the intensive care unit as the first wave started to dissipate was quite different to what we normally see. A lot of them were the consequences of the lockdown. Psychiatric type admissions, a lot of unusual types of trauma, and patients presenting with diseases that were further advanced than we would normally expect to see in a sort of Western first world healthcare delivery system.
Shouldn't be too much longer. Just like any other vaccine, you may have a little pain in your arm or down the arm,
and you may feel a little lethargic over the next couple of days. It passes very quickly. Okay?
Sure.
If you're feeling any unwell, get in touch with your GP.
People have been through an awful lot for the last 12 months. It's a really big ask to ask people to not holiday, to not mix with their friends, to curtail their lives for quite a prolonged period. The only sense of frustration is that we do seem to be on the cusp of a game changer in terms of vaccine rollout, and it would be nice to allow this another 6 to 8 weeks to a couple of months and see with vaccine rollout, can we then really get back to more normal practices.
And you're done. Congratulations. Have a little look at that.